Grandpa!
Bring your kitchen to life. The architects and contractors at Jeeves and Zuzu are here to help you explore the possibilities. Have the life you want. Call Jeeves and Zuzu today.
Tonight we will be examining the opioid epidemic and its impact on New Mexico. KRQE News 13 is proud to partner with the Mark Wahlberg Youth Foundation, the DEA 360 campaign, and Walmart on this important special.
We will be talking with experts and advocates as we learn about the dangers of opioid misuse and addiction. But we'll also discuss local resources available to those dealing with any form of substance misuse.
Children, parents, teachers, first responders, doctors, co-workers, and friends.
He was just a kind of a normal kid that did everything that, 15, 16, 17-year-old kids should do.
People with substance abuse disorders are ordinary people, and the latest numbers show thousands of New Mexicans are struggling with addiction.
This issue is becoming more and more prevalent with every single day that passes.
In fact, 1 in 3 of us know someone who is struggling right now, and it is not a moral failing.
A lot of the people that we work with, the vast majority, really do want to stop engaging in these behaviors, but they can't without assistance. That this really is a medical illness.
And help is out there.
There is help out there, and there are people that love you and that care for you and that will do the extra for you, and you just got to be willing to find it.
To get the conversation started, we spoke with the executive director of the Mark Wahlberg Youth Foundation and Mark's older brother, Jim Wahlberg. I get the sense from that own personal experience that we walk around acting like nobody knows an addict, like it's some rare thing off in some corner, like, when the truth is if we all sat down and got honest about it, we would all have in our orbits people who are suffering or struggling with this.
I don't even think we would have to think that deeply. I think everybody now, addiction is mainstream. It's happening here to people across every race, gender, economic status. It's happening to people across our country and across our world. And we really need to love each other. So a lot of people still look at this as a choice, right? Mm-hmm. Who would choose to be fully addicted to opioids? Who would choose to be out in the street? Who would choose to risk their life every single time they pick up a needle or a drug that this might be their last time, that they might overdose and die, right? And I don't mean to, not everybody that's addicted is a victim, but many, many people of this, are victims of this epidemic. That, they walked into a doctor's office, never having had an issue with drugs or alcohol in their entire lives, got injured, walked in and walked out with a prescription full of pills that would kill you.
Tell me about your own experience, because this is so personal to you. Clearly, it's a major part of all this work that you're doing. Tell us what it's like to be inside that.
It started at a very, very young age for me. I was drinking alcohol and hanging on a street corner by the time I was 10 or 11 years old. For me, I just was always missing something. I never felt good enough. I never felt worthy. I felt sort of lost in this wave of 9 kids, right? I'm the middle child of 9 kids, and my parents were busy working 24 hours a day trying to feed us, and I was looking for love, and I was looking for it in all the wrong places with all the wrong people, And so ultimately, what happened is that I found what I was looking for in drugs and alcohol, or at least I thought I did. And what happens is that you get that sense of comfort, but ultimately it turns on you. And for me, it turned on me at a very young age. I was in and out of jail, juvenile detention, and then on to the House of Correction and state prison, all by the time I was 17 years old.
What got you out of that, Jim?
Well, it's a combination of things. One, it was a simple math equation. I was doing 6 to 9 years, and I didn't want to do 9 years. So I started to try to create an illusion that I was trying to get better, right? Prior to my going to state prison for the second time, I never heard of a self-help group or a 12-step program or a rehab I never heard of any of that. Yeah. I was back in prison. I was doing 6 to 9 years. I didn't want to do 9 years because if I did 9 years when I get out, it was going to be older than 30, and that's prehistoric. right? And so I started to do things to create an illusion that I was trying to get better, that I was trying to get rehabilitated. And, you know, I remember being in those meetings and thinking to myself, what an amazing program this is for these people, but it's never going to work for me, because inside I didn't feel worthy of what they were talking about, that I didn't feel worthy of the life that they were saying to me was possible. And then for me also, it really took a miracle, you know, and my miracle came in the form of Mother Teresa, came to the prison I was in, and they had a mass in her honor. And the words that she spoke were words I never heard before, about that I was more than the crimes that I committed, that I was a child of God.
And Jim, your hope now for people who are in that circumstance now?
So, you know, their help is available, but it all starts with the individual, right? What am I willing to do, right? What am I willing to do? And it's a process. It's a process to get to the place where you're willing to do anything, right? When you feel unworthy, right? And listen, there's a lot of, we talked about stigma, but there's a lot of shame and there's a lot of pain and a lot of brokenness that goes along with this addiction, right? And it's a long road to heal, but healing needs to take place. It's not about just removing the drug, right? That's a very good beginning, but it's only a beginning.
New Mexico had the 15th highest drug overdose rate in the U.S. in 2018. About 2 out of 3 of those deaths involved an opioid. That's according to the New Mexico Department of Health. Here to talk about the dangers of using opioids incorrectly and how they can affect the human body is Dr. Juliana Reese. Dr. Reese, thank you for being with us today. And we'll just begin. Can you just explain what are opioids?
Sure, absolutely. So opioids are a class of drugs that are essentially used for pain relief in the medical community. There are different forms of opioids that come from natural sources, semi-synthetic and even synthetic brands such as oxycodone, hydrocodone, fentanyl. The natural opioids are termed opiates versus the term opioid.
Can you explain what they can do to the human body?
In general, short-term use of an opioid is can be very safe if monitored by a doctor. It's the long-term use that gets a little bit more complicated and difficult. So our bodies naturally produce chemicals called endorphins whenever we experience life events that can cause pleasure. Also, you can have endorphins released when you have pain. So that's why opiate medications can be helpful in traumatic pain, because as you are experiencing a trauma or traumatic pain, your body naturally releases these chemicals, and it sort of gives a pleasurable effect to help reduce that pain feeling. And so the other things that the opioids can impact are systems in the body that control your blood pressure, your respiratory rate, and even your mood. So when you have too much, then obviously those systems can be affected very significantly and can be deadly. And in a long-term form, in lesser amounts, other things can happen that lead to addiction.
And can you talk about that? How come they're so addictive?
Yes, it's a really interesting thing, because opioids have this capability of sort of hijacking the brain and using one of our innate natural systems that humans have had for thousands of years that we basically use to survive. So there's a center in your brain called the reward system or the reward pathway. And just without opioids in the picture, say I am trying to survive and I eat some food and I taste that food, I like that feeling, my brain remembers that, because as I'm eating something pleasurable or doing something pleasurable, this chemical gets released in my brain and causes my brain to remember that feeling and that taste and that smell and everything about that experience. And then you start to crave that again. And again, through thousands of years, this was a good thing for humans. It was a natural response. But what opioids do is they take advantage of that reward pathway, and they use that same system to just kind of take over the craving center of the body, and that can lead to addiction.
We would like to welcome our Attorney General of New Mexico, Hector Balderas. Hector, thank you so much for joining us today.
It's an honor to be with you. Thank you.
And Hector, you've really made fighting the opioid problem in our state a priority. And tell us why. What kind of impact is it having, and what kind of problems are we seeing with New Mexico families?
Our strategy really includes three areas. First is to hold corporations accountable for flooding New Mexico for decades with cheap pain pills. Number two, it was to litigate civilly to rebuild a safety net in New Mexico that New Mexicans have been denied for many generations. And number three, it was to use the arm of our criminal laws against doctors who are overprescribing and taking advantage. I basically wanted to change the way business was done in the medical practice, and secondarily hold people accountable for really acting like drug dealers and flooding our families with excessive drug activity in a way that New Mexico has never deserved.
Hector, you've taken a different approach in fighting this problem in our state, and one of them, as you mentioned, is going after doctors who overprescribe. And tell us about some of the cases you have seen and how you've gone after doctors.
It was truly heartbreaking because many of these family members had the right instinct that doctors had contributed to their loss of a loved one. And what was very offensive is there had never been any intervention from any oversight agency to even investigate these type of cases. And so we began to investigate, and we've indicted some doctors who abused the pain management process in favor of profits. And many families in New Mexico really have felt a sense of distrust from the medical profession. And so we have had to charge some doctors and bring them to a court of law to hold them accountable.
And you also mentioned you were the first in the nation, the first attorney general in the nation to go after pharmaceutical companies, and you filed a lawsuit against them, also expanding to stores, CVS, Walgreens, different pharmacies. And tell us about that lawsuit.
Well, they took advantage of patients. You know, we're a very trusting community, and doctors, manufacturers, and producers of pain medication were very aware of the addiction dangers involved, and they also marketed mass sales to families without really disclosing the level of risks that these patients were exposed to. So for many years, the federal government has been involved with a lot of these profit centers without protecting the health, safety, and welfare of citizens. So we were the first Attorney General's office in the country to sue the entire supply chain. And I also think what we're trying to get out of this litigation is I want that supply chain to rebuild our safety net, which is the future generation of our children and our elderly in New Mexico. They deserve better and more.
Attorney General Hector Balderas, thank you so much for joining us today and for taking your time to fight this battle in our state.
Thank you for having me.
For some, seeking treatment is made even more difficult by a lack of health care coverage. But the city of Albuquerque is striving to make sure everyone who needs services has them.
One of the biggest programs that we've been investing in for years is access to treatment, evidence-based treatment that follows national guidelines for individuals who have either no insurance or can't afford their co-pays. And when you look at a policy level, that's huge because individuals sometimes have to choose between a tank of gas, providing food, and or paying a copay to go see their therapist once a week for that treatment, right? And that's huge cost.
The city's PATH program offers vouchers for addiction treatment for those who can't afford it. To access services, potential clients make an appointment for a substance use disorder assessment directly with one of the city's treatment providers. After conducting that assessment, the provider determines if they need treatment and schedules the client for services. These programs are funded through the Department of Family and Community Services Division of Behavioral Health and Wellness. You can find more resources offered by the city of Albuquerque. Just go to always on KRQE.com. What we know for sure about the epidemic is that it does not just affect one region of our state or one ethnicity. We spoke with 3 New Mexico lawmakers, each representing diverse areas of New Mexico. They explained the impact they are seeing in their districts, what is being done, and what must be done to address this public health crisis. I want to start with Senator Lopez. If you could just tell us a little bit about your district, how this problem manifests among your constituents, the problems with trying to solve this problem and what you think needs to be done.
Well, good afternoon, and Linda Lopez again from Senate District 11, South Valley of Albuquerque. Here in Bernalillo County, the issue on opioid addiction is pretty wide. When we look at specific areas, such as my area, which is the southwest quadrant of Bernalillo County, we actually are not the highest in the county with numbers of opioid overdoses and or other issues concerned. But in looking as to what's happened in our community, when we talk about opioids, a lot of persons, of course, will get addicted to them because of a prescription, which we know. There's also other issues with regards to heroin, which sometimes is the follow through. If you can't access any more prescriptions, you then turn to heroin. Fentanyl, of course, is another issue that's come in that's like steroids for codeine. So, I mean, it's all of these particular issues. But in my community, we have certain providers that do work with different members of our community, such as we have La Placita, working with one of our renowned community members. They do provide services, but it's more for culturally based, looking as to how they can work with the persons who come forward. And of course, working with family. So there's more of what I call a holistic approach as to how we can help our families. We also have limited access with regards to behavioral health services. So we have Centro Savila, which does have a list of persons that they're working with. But again, as we look as to how we address the issue, we have limited service providers, again, that are culturally appropriate, can speak Spanish, and working with the different members of our community also. And then, of course, First Choice Healthcare, and you can look at some of the services they do provide also in conjunction with the University of New Mexico. Youth Development Incorporated is here also in Casa de Salud. I wish we could have some much more far-flung services that could be offered just here in Bernalillo County. And as we know, for access too, is with regards to Narcan, which is so important. The state did pass a law several years back where we do afford now that law enforcement have access to Narcan, so that if that's necessary in a call, if they do come, they can administer that at this point in time. Training and all the other issues that exist, those are still, I think, many more of the issues that need to be brought out. So how we can, I think, confront this epidemic that is running through our state.
Senator Lopez, thank you so much. I'd like to shift now to Representative Lente. Tell us a little bit, Representative, about your constituency, your constituents, and how this problem shows itself in your communities.
Thank you. Good afternoon. Again, Derek Lente. I represent the 65th District in the New Mexico House of Representatives. The 65th District is geographically large. I have in my district 7 pueblos, 5 chapters of the Navajo Nation and the Hickory Apache Nation, and the largest non-native community in my district is the town of Bernalillo. And so when I think of the district, the way that the reliance and the opioid addiction has shown itself is the number of people that have found themselves trapped in the cycle of opioid addictions and then having to go to treatment centers, and in some cases having lost their lives in our communities. And so I think based on the comments from Senator Lopez is that this is not an urbanized issue, that this opioid addiction respects no boundaries. And so when we look at these types of issues, it has found its way into small Hispanic communities. It has found its way into the Pueblo, the Navajo Nation chapters, as well as the Apache Nations as well. And so these matters are all taken very seriously. And was mentioned earlier is that in 2017, I was part of the legislators that passed a piece of legislation titled Opioid Overdose Addiction, House Bill 370, and that was in 2017. And what that sought to do was to create an education program for those that are coming out of treatment centers, for those that are coming out of jails, to educate them on the use of Narcan and how that could be a potential lifesaver for them, as well as then ensuring that all of our first responders, namely law enforcement, carry Narcan with them so that those that are finding themselves having overdose can hopefully have their life saved. And so with that being said, these are things that happen at the back end, but in the front end, there are a lot of things that are happening in terms of community education that must happen in all of our small communities, whether it be from the federal government or the state government. These types of community efforts have to be done to ensure that our children, our young adults, and our seniors are well aware of this opioid epidemic that is taking place, as well as, again, ensuring that they understand that it respects no boundaries and that we are all vulnerable to all of these types of issues.
All right, Representative Lente, thank you very much for your insight. I'm going to move now to Representative Montoya. Some of the same part of the state in terms of Rio Arriba County. Representative Montoya, tell us about the problem in your community.
I represent a vast district, rural, very rural district, 40. Colfax County, Rio Arriba County, Mora County. Much of my district is Hispanic farming communities that are hard hit by this epidemic in the deepest way. One of the most important challenges that we face is that much of the root causes stem from trauma, cyclical poverty. Our education system needs to really focus on how we can address these issues, and some of the most important service provisions that I have brought forth really settle in the aftercare program realm, where children that are really needing to find that sense of place, that sense of focus, that sense of healing. I have used the arts in a certain prescriptive way to drive home this notion that we are more than our past. So much of the addiction issues in Rio Arriba, I believe, are stemming from an intergenerational process that repeats itself, and many of our kids are sort of mired in this notion that they can't ever change from that. And so I believe that this recent influx of educational dollars will help us to look at programs like communities in schools, aftercare programs, early child interventions that I believe in the long term will make that difference to heal families. In this region, we have programs like the Española Pathway Shelter, which is a project that I helped to stand up this last year. And we intentionally provide pathways into programs that include Delancey Street, Oi Recovery, the Darren's Place, 110-bed, facility that focuses on treatment. I think the only way that we're really going to make a long-term difference is to look towards healing and dealing with the root causes of trauma. Again, I just have worked for about 3 decades in this beautiful county, and I just see that that is the most prescriptive way to bring the change that we must.
All right, Representative Montoya, Representative Lente, and Senator Lopez, we thank you so much for taking time to give us some insight into your communities, but also for the ongoing work that you're doing to try to solve this very difficult problem all across our state.
Jennifer Weisberg's son, Cameron, was a typical 16-year-old. He started using prescription pills after a high school sports injury. He died of an overdose in 2011 when he was just 18. Tonight, Cameron's story and how it led to his mother starting a recovery center for New Mexico teenagers.
His name was Cameron, and he was born and raised in Albuquerque, and he led a very normal life. He loved sports. He played sports from the age of 5. He was a soccer player, a football player, a wrestler. So he was just a kind of a normal kid that did everything that, 15, 16, 17-year-old kids should do. And unfortunately, he found himself mixed up in a world that really he knew nothing about. My story with my son's addiction started in 2009. He was a junior at La Cueva High School, and I found out that it was after a wrestling injury. He had surgery, and he was prescribed prescription opiates. And, you know, I didn't really think anything of it at the time. I didn't really know they were dangerous or addictive or anything like that. So he took his prescription as prescribed by the doctor. And then unbeknownst to me, you know, he really liked the way that those painkillers made him feel and continued to abuse painkillers after his prescription ran out. He got them from friends, he got them from other people, he started buying them, and it led to his addiction to opiates. He would buy them, at first it was from friends and people at school, and then as his addiction progressed, you know, he eventually started using heroin, and the pills just weren't enough for him, so he moved to heroin, and then he was buying it from dealers on the streets. And he struggled for 2 years. You know, he was in and out of treatment, he was in and out of jail. You slowly watch your loved one just kind of turn into somebody you don't know, and you just kind of lose them. Even though they're still alive, you slowly lose them, and you try desperately to get them back. And with my son, I tried for 2 years, and he ultimately ended up passing away of a heroin overdose when he was 18. After my son passed away, I went back to my regular job, and I worked there for about 8 months, and it just wasn't the same. Like, I couldn't get my head in the game. I kept feeling this tug, like I needed to be doing something different. So I ended up contracting with the city of Albuquerque to open a treatment center. And I just pled my case to them, and I just said, you know, there's not enough resources for kids out there. So we opened Serenity Mesa, which is a treatment center for young people age 14 to 21 in Albuquerque. And we treat kids all over the state. They come to us from all corners of the state. And really we provide a safe place for them to get sober. So we're not a locked facility. You know, if somebody doesn't want to be here, they don't have to be here. So we have a home environment, so it's like being in a home, and that's what I wanted to create. I didn't want a hospital environment. I didn't want them to feel like they were being admitted into a hospital. I didn't want it to feel like jail, where there was, you know, bars on the windows and a locked gate. I wanted it to be this open environment where they could come here and work on the things that they needed to work on individually. So whether that be their family issues, whether that be getting their high school education, going to college, whatever, if they had trauma, if they had been, you know, sexually abused, whatever that is, we focus on the whole picture, not just the substance. It's about their whole life, and how do you give them the tools so that then they can leave this place and go back into the world and not use substances as a way to cope. The boys' lodge is called Cameron's Lodge, so obviously named after my son who passed away. We opened in May of 2015, so we've been open almost 6 years. We have been able to help, about 325 young people. So it's a lot. I mean, if you think of, it's sad to me, because we get 14 and 15-year-olds in here all the time that are addicted to drugs like fentanyl. You know, a 14-year-old that's addicted to fentanyl just blows my mind, because that is the most powerful drug out there right now. And to see them struggle with just how do you function normally, you know, in a world where you've been using fentanyl every single day. It's just, it's difficult for them. But we meet them where they're at, and we help them. We have really good therapists, we have case managers, we have life skill coaches, we have peer support workers. We have a good breadth of experience and people that work here that can help them, whether it's learning how to do their laundry, learning how to make their bed, learning how to do a resume, learning how to interview. We do mock interviews. We have plaques throughout the garden in memory of people who have passed away of an overdose. So we have them kind of throughout the whole garden. My best advice is your gut instinct is probably right. So if you think that something might be wrong with your child, it probably is. Because I had that nagging feeling for a long time, and I kept brushing it off. I kept thinking, oh, it's just, you know, he's just a teenager, or this is what teenagers do. And I really wish I would have acted sooner.
How do you talk to a loved one if you think they are suffering with substance abuse? Dr. Larissa Maley, who works as Director of Behavioral Health Clinical Programming for the University of New Mexico Hospital, shared some important information with us. Let me start by asking, what do you think are some of the biggest misconceptions that people might have about opioid addiction?
Why can't they just stop or quit? That it's a lack of willpower, or it's a character deficit. And I think nothing could be further from the truth, that a lot of the people that we work with, the vast majority, really do want to stop engaging in these behaviors, but they can't without assistance. That this really is a medical illness.
I want you to speak to parents in your experience about what is the most effective way to keep your kids away from this kind of problem.
But I think a lot of the recommendations would say to just really talk with your children, not just about drugs, but about their life. So parents that are actively involved with their children and know what's going on in their life and can help them to achieve success and mastery and the kind of things that are important to them are going to be less vulnerable, even if they're exposed, even if they're around peers that are using those substances. The reality is it's pretty normal for children to experiment with drugs. So it's not about removing them from society in a way that they are never exposed to it. It's about helping them have enough stability and enough resources to manage it when they are exposed to it.
What do you do if you suspect that your child is using drugs?
I think that's a great opportunity for parents to just sit down with their kids and say, I'm concerned about you. Help me understand what's going on. These are the things that I'm seeing. And I just want to make sure that I'm here to support you and help you.
Tell me if you have a child who is suffering from opioid use, addiction, misuse. What do you do?
To kind of figure out where's the right next step for the kid is going to have to be individualized. It is not always the benefit of the child to send someone who's experimenting with drugs to a residential program or to remove them from their home as a way of dealing with it. Sometimes starting at the right level of care is really the best next approach. How much are they using? What are they using? And if the parents don't feel comfortable having that conversation, it could be helpful to bring in a medical provider or a therapist or someone who could help navigate that conversation to make sure we're getting enough information to recommend where they should go next.
Doctor, is there anything else I haven't asked you that you think is important that we get in?
I think the one thing that I would like the community to really understand is the impact of stigma, that when they carry around a lot of stigma or bias about viewing people with a substance use disorder, opiate use disorder, as being someone who's other or someone who's different or someone who's bad or broken, that really can be extremely hindering for people. It affects how they engage in treatment. It affects how long they stay in treatment. And so trying to see them as temporarily sick and absolutely capable of getting better. I think that's the message that we want the community to understand.
UNM has been a leader in research focused on addiction, prevention, treatment, and policy. The Substance Use Disorders Grand Challenge is a team of more than 90 experts. Dr. Brandy Fink from the Department of Psychiatry and Behavioral Sciences leads the team.
The thing I like to stress when thinking about substance use disorders is that our normal reward systems have been hijacked by substances, and that it's a chronic relapsing disorder. And so understanding that and treating it like that, much like the way we treat hypertension, diabetes, asthma, those types of approaches are much better, result in much better outcomes for individuals than thinking that it's a matter of willpower or the person is, deficient in some way, and that's led to their substance use. We have really good understandings of what adverse events people may be exposed to and how that makes them vulnerable to developing a substance use disorder.
How long does it typically take to get them the help that they need and really get them back on their feet?
I would say, like for medications, we see people who have stayed on the medication for at least a year have the best outcomes, but sometimes it's a lifetime. So I often equate it to a substance use disorder and the treatment of it to the treatment of diabetes. So only 5% of people are effective at controlling their diabetes with diet and exercise alone. And that's the same with a substance use disorder. The person may need to stay on medication, for the rest of their life or for an extended period of time. And really the behavioral treatment is to help them kind of deal with what the brain has mislearned.
Your research also looks at not only how it impacts the entire family, but also how it impacts society.
Correct.
And
right.
What have you found?
I think it's important to address, thinking of the long-term consequences of substance use, to also address what we know are clear predictors of it. So child physical abuse and neglect, household dysfunction, verbal aggression by parents, exposure to community violence. We see that there is a direct relationship between the frequency of being exposed to these types of events as a child and the onset of a substance use disorder later in their life. So if we're going to do prevention type efforts, really focusing at, creating healthier environments for our kids to grow up in is a really significant way to impact that and have long-term societal impacts as well.
The opioid epidemic not only has an adverse effect on our public health, but it also adversely impacts our public safety. To explore the impact of the epidemic on criminal activity, we spoke with DEA Special Agent in Charge, Kyle Williamson. What is the degree of usage in the community and who is using?
Okay. Well, overall usage is up, both with juveniles and with adults. However, there is a concern among juveniles. A recent survey showed that amongst the juveniles that are students that were being surveyed, that 1 in 4 of the students were using marijuana at the time, and that a high number of students reported using cocaine, methamphetamine, and heroin. So that's a concern. The marijuana usage is always a concern because marijuana is viewed as a gateway drug.
We have a lot of parents watching tonight. Can you explain to them how easy it is for kids to get drugs and where are they getting them?
Well, unfortunately, a lot of the kids are getting their drugs via social media. So it's very easy to connect to your local retail drug dealer over social media now, and that is a big concern. So with parents, it's estimated that, for example, that only 40% of New Mexicans actually secure their prescription medications. So a lot of teenagers have access to controlled substances in the house that are in the medicine cabinet.
What should people do with their unused prescription medications?
Well, the first thing they should do is keep them secure. The next thing would be not to throw them away, because if they throw them away, somebody can get them out of the trash can and either use them or sell them. Next, we don't encourage anyone to try to dispose of them. For example, flushing them down the toilet. We care for the environment. So the best thing is to go to DEATakeback.com, and the person can find the nearest location to them to properly dispose of the unused medications.
Kyle, anything else you'd like to mention?
One other thing that's very important and that I didn't really talk about, and that was fentanyl use. And fentanyl is probably, along with methamphetamine, they're our biggest threats right now. And what's concerning about fentanyl is it's manufactured in Mexico. It only takes 2.2 milligrams of fentanyl to kill a person. On average, the fentanyl pills that we're seizing contain about 1.8 milligrams of fentanyl. So that's not a lot of grace in the amount that's in those pills. And because it's manufactured in a clandestine environment, that means that the pills, it's very concerning because, again, it's in pill form. So it's very attractive for our youth.
Kyle, thank you so much for your time today and for taking part in and sharing your knowledge with us.
Okay, thank you very much. My pleasure.
In 2014, voters passed a gross receipts tax to pay for more mental and behavioral health services here in the metro. That has helped the Bernalillo County Department of Behavioral Health Services to better address the opioid epidemic head on. How bad is this problem in our community?
So I will say that this issue is becoming more and more prevalent with every single day that passes. We see crime associated with opioid addiction. It's not just overdose deaths that we are seeing increase. We're seeing crime. We're seeing the exposure of needles in the community increase. And so we are seeing that this issue is definitely something that the community and our local government and healthcare organizations need to continue to work to address.
Director of the Department of Behavioral Health Services, Margarita Chavez Sanchez, says their efforts include regular needle pickup in the community. In recent years, they also launched an app where people can report needles they find. The county also works with local law enforcement, public defenders, and the DA to get offenders who have opiate disorders help rather than just sending them to jail. You can find more resources offered by the county and the variety of programs they offer at always on KRQE.com. We end tonight with a young woman's journey to recovery.
At just 19 years old, Teresa Garcia had to make a choice, get clean or go to jail. Tonight, a look at how she's turning her life around. We'd like to welcome Teresa Garcia and welcome to our show tonight. And she's here and you're on a road to recovery. And let's just start from the beginning. How did you get addicted?
Well, I was about 17 and my dad had went to jail. While he went to jail, I kind of lost my mom too. And then I just kind of spiraled and went off the grid, started smoking fentanyl and shooting up meth on the daily and just totally losing myself.
And it led you down a really bad path.
Yeah. So for like 3 years, just every single day, just shooting up, smoking fentanyl, smoking oxys. And then, of course, I've been in and out of jail since I was 18. Finally, my last incarceration was at MDC for 10 months, an armed robbery charge. And I got out September 24th. And well, this is kind of like all I ever know, and so I kept on just doing bad, even though I knew that was like my last chance, and just went on the run again. And I'm into a program called Young Adult Court, and so it's just kind of like drug court, but for young adults. And they do like a screening process of 90 days in order to get in, and I was just messing up, and I had one more court appearance, and I thought I was like weighing the options, like should I run and just not even give them a chance to let me go to prison for 4.5 years, or should I just go in and take that chance? Because if they do, then you'll be fine, but if not, like what do you, like, you know what I mean? Just totally weighing my options. And it was since COVID hit, it's all over the phone. So I called in and they gave me one more chance, and I was all strung out, and I actually took the step and I got detoxed, and then I came here.
What was your final straw? What was, you had to make that decision, and
yeah, I don't know.
How tough was it making that decision?
It was, honestly, I don't even know. I don't even know how I got, like, it's just, it's God, I feel like. I don't know. I was like so lost and so stuck in my ways that nobody thought I was going to take that step to come into rehab. Nobody, I was talking about it, telling all my friends, like, I'm going to go, but I didn't know if I was going to go or not. And then it's just I have like 4.5 years in prison weighing on me, you know, and it's like I can't do this forever. And if like I'm choosing to live this bad life, and I'm choosing to do bad. But if I choose to do good, then I could do good. But you just have to have that like mentality. And here at Serenity Mesa, I'm so honored to be here because like they just believe in you. Like I never had so much people believe in me so much. Like the help that they have for us here, it's amazing. Like all the staff, they all like stick their heads out for us, and they do, and they give us like wise words, and they're just there for us so much. And like I feel like this is just like a whole new life for me. I feel like it's a whole new start, and I feel so blessed every single day to be here.
You became addicted when you were 17?
Yeah.
Can you tell people at home how hard it is to kick this habit?
Oh my gosh. you have to really want it, and you have to have like stuff, something you have to really want it for yourself, nobody else. The kick, that was horrible, but you know, it's just always like you're just having that faith that it will get better. And being strung out for like so long, like just doing the same thing over and over and over, you get stuck in those ways. Like you lose yourself, you lose yourself.
What's next for you?
Well, right now, so they help us get our GED and everything here, and so I'm getting my GED. And then I want to be like a therapist or something, I don't know. I just want to give back somehow.
What advice do you give to other teens that are either struggling, or they've tried pills, or they've tried these drugs? What advice do you give to them?
There is help out there, and there are people that love you and that care for you and that will do the extra for you, and you just got to be willing to find it. And the first things first, you do got to find it in yourself, because if you don't love yourself, if you can't like just find the strength within yourself, then you just need to look harder, because everybody has a purpose.
We hope that the information we shared in this program will help everyone better understand the dangers of opioid and other substance misuse.
We invite you now to join some of our guests for a real-time live discussion on KRQE's Facebook page. They will be available to answer questions that we didn't get the chance to address during tonight's special.
Again, our thanks to the DEA 360 campaign, the Mark Wahlberg Youth Foundation, and Walmart for partnering with KRQE News 13 and making this important program possible.
And we thank you for joining us. Have a great night.
Grandma! Grandpa!
Bring your kitchen to life. The architects and contractors at Jeeves and Zuzu are here to help you explore the possibilities. Have the life you want. Call Jeeves and Zuzu today.
Where power meets performance,